Hi, good afternoon, everybody, and thank you for joining us on our masterclass on the benefits of digital social care records. We're just going to give it a couple of minutes for people to join, as we do have a lot of people registered to be here today. So just to reassure you, you are in the right place, and we'll be starting probably about 2 minutes past. We're just going to give it another minute or so, but welcome to our masterclass on the benefits of digital care records. Right. It looks like our sort of numbers have stabilized, so we'll make a start. So we have a lot of really interesting content to get to today. So thank you so much, as I said, for joining our masterclass on the benefits of digital care records. My name is Katie Thorne. I'm the project lead for Digital Care Hub, and we've got a great range of speakers who are here today. So just before we hand over to them, we'll sort of run through some housekeeping, which is just on the next slide. This webinar is being recorded, and all attendees are on mute and we can't see you, I'm afraid, and we also can't hear you. So if you do have any questions for any of our panelists, please use the Q&A function, which is, you should see if you're on a computer at the bottom of your screen. If you're on a phone or a mobile device, you might need to tap the screen and then it will pop up in options. If you'd like to introduce yourselves, please use the chat. We always like to hear where people have come from, and also please use the chat if you're having any technical difficulties, and myself and my colleague Eleanor will try and help you with those. As I said, we are recording this session, so you will get access to the recording and to the presentation following this meeting. So we have some great speakers, as I mentioned today. So first up on the agenda, we'll have Nina Gavin and Hayley Robinson from ICE Create. So we're going to be talking about understanding the use of digital care records in social care, specifically focusing on some of the research that they did with Devon ICS and the care homes across Devon. And then we'll pass on to Ryan Spencer to talk about the shared care record in London and one of the care providers who are in London who've been working quite closely with Ryan and the team. We have loads and loads of time today as well for questions. Please do keep them coming throughout. We'll try our best to keep monitoring them as we go along. And if there's any questions that we don't get to or we don't manage to answer within the time of this webinar, we'll make sure to take note of them and we'll come back to you via email as well. And so on to the next slide then, please. Just in case anybody isn't aware of Digital Care Hub and who we are and what we do, the Digital Care Hub is a partnership project run by the Care Provider Alliance, so the National Trade Associations for Adult Social Care Providers. We represent care providers of adults across England, and that sort of services for working age adults as well as for older people in care. Across the Care Provider Alliance membership, we cover almost 10,000 organisations who employ over 600,000 staff and support an estimated 1 million people in England. So we're funded by the Department of Health and Social Care and NHS England, and we're really, really pleased that the NHS Transformation Directorate's Digitising Social Care programme has funded us to run these webinar series, which will be happening for the rest of the year. If you haven't already, we do have another webinar in 2 weeks on the 30th of July looking at data standards, which is also funded through the same programme. And finally, just to say, all of the support, advice and guidance that we offer on technology, data protection, cybersecurity is all completely free to access for the sector. So without any further ado then, I'll pass on to our first speakers. So Hayley and Nina, over to you.
Brilliant, thank you, Katie, and yeah, pleasure to be here today to share some of our recent work that we've been conducting in partnership with NHS Devon. So my name's Nina and my colleague Hayley is on the call as well, and we are from ICE Creates and we are behaviour change specialists. And we partnered with NHS Devon to conduct some behavioural insights to understand the use of digital care records. Next slide, please. So yeah, just again, a little bit about us. This is our vision and why we exist as an organisation, and it was a real pleasure to partner with the likes of NHS Devon to work on a project like this, which is all around enhancing the use of digital care records to make things easier and more efficient, both for the workforce, but also for service users and families as well. Next slide, please. So just one slide here on some of the methods that we use to underpin the insights that we're going to share with you this afternoon. So we used a qualitative research method that involved going out and speaking to care home provider managers, members of the care workforce, and family members and service users. So we conducted over 100 face-to-face interviews, including taking the research out into the heart of care provision. So by shadowing a domiciliary care worker, being in care homes and speaking to residents there to really get that breadth of view. And we do very much pride ourselves on reaching some of those cohorts that often go unheard in typical public consultations and research. So a really robust sample of over 205 people. Next slide, please. Brilliant. And so from the research that we carried out, there were three key themes that emerged from our behavioural insights and from our findings. And while the wider insights that we conducted gives us that insight on the use of digital care records within social care as a whole, rather than focus on the experiences and the benefits to the system and organisations, the focus for today's presentation will be on the third key theme that emerged, which was very much around the use of family and the use of care records among family and service users. So actually thinking, what are the benefits to those cohorts, and indeed what were some of their concerns and needs as well when we think about potentially optimizing that use. So I'm now going to hand over to Hayley, who's going to share some of those findings, and then we'll finish with a few recommendations as well.
Yep. Thank you, Nina. Yes, my name is Hayley. I'm Behavioural Insights researcher at ICE Creates. So yeah, DSERs, the family access, was considered important both to families and service users alike. Specifically, when we asked service users if they would like access to their own DSERs, people receiving residential care were more likely to report not wanting anything to do with that, compared to those receiving domiciliary care. Although it's important to note we had quite a small sample, and of course not necessarily reflected by everyone in residential care. And for a bit of context as well, those people that we spoke to in residential care said they didn't want it because they trust the girls, i.e. they trust the people in the care home. But for those receiving domiciliary support, they wanted to know who will be coming. So if there are any staff and time changes, this means they know who to expect and when they're going to be visited. So for the families of service users, DSERs were really important in keeping them in touch and helping them feel connected to the family members, but also connected to the care. So many families, gosh, can't get my words out, many families have provided some level of unpaid care to their loved ones previously. They know what the family members need, and they naturally worry or want reassurance of the care that they're receiving at the moment. So if families can access the DSERs, it means they're reassured their loved ones are okay and they're happy and they're doing what they enjoy. There was one there's one family member we spoke to who had spent some time living in America, and they'd said DSERs would have really helped them because they were living in a different time zone. They had communication barriers, and they wanted just to know and to have that reassurance that their mum, for example, was feeling okay and doing okay, without having to feel like they're constantly reaching out to care providers and bugging people to sort of know that they're doing it all right. But more than family members simply having access to DSCRs, they wanted to be able to communicate with the care workforce, as the DSCRs provides easy and really efficient ways to direct questions or concerns or any important updates about their health and well-being. Okay, next slide, please. Okay, so what do families want to see on loved ones' DSCRs? So at the most basic level, families simply want to know that loved ones are okay and that they're receiving personal care. So for example, they want the DSCRs to confirm the family members are safe and that they're up and they're eating, what the mood is, how they're feeling on that day. Knowing what activities the loved ones are doing helps families feel connected, that the mum, the dad, the sister was okay and that they're doing what they enjoy. And in some instances, the DSCR, the family facing element, has that option to send photos as well. And that was there was an appetite to be able to access that too. In terms of health data that we've got up here, that relates to things like sleep patterns, blood pressure, medication changes. So a couple of people noted how disruptive the medication has been on the mum, for example, and being able to be notified of any changes would help them keep in touch and know that they're going to be doing okay, or know whether they should expect any changes in their behaviour or so. But it's important to know, so although these are a list of what people wanted to see, this is from everyone we spoke to. So everyone is different. All family members are interested in seeing different things and different level of information as well. So some families we spoke to, for example, they wanted to be notified of absolutely everything on the DSCRs, whereas some just want to be notified of any incidents happening or anything like that. Okay, next slide, please. Okay, so importantly, although there is an appetite to have that family-facing element of DSCRs, many did not have access to it. So ultimately, this means families are less in touch with a loved one's care. They don't feel as connected. And going back to families that might live far away, for example, that person living in America, or maybe even a couple of hours away, even just 20 minutes an hour is quite a long way away from someone who is worried about their families. So it means they're worried. They might be constantly calling care providers. They might feel like they're bugging them. And also having to do this can go towards breaking down those relationships between the care providers and the families as well. And again, going back to the carers, often the family members often had a big part, played a big part in their life, either as unpaid carers or someone that checked up on them or so on. And they felt that not being able to access the DSCRs or to input anything or even see the care meant there was a lack of recognition in their expertise and knowledge of their loved ones as well. Okay, so finally on this slide, managers and staff wanted the family-facing element, but it was expensive and this was often dependent on funding, of which sometimes was limited. Okay. Yeah. So staff and managers sometimes felt concerned about providing full family access, due to potentially highlighting human error on the DSCRs. So a few staff and managers welcome the challenges from families if there's any mistakes, they were ultimately worried about how this access to DSCRs might cause unnecessary worry for families. So as an example, we spoke to someone whose mum was receiving domiciliary support. And that person accessed the family-facing record and saw a mum, for example, let's call them Elsie. The DSCR said they'd gotten out of bed, but they were thinking, how on earth has she gotten out of bed? She can't get out of bed by herself. But due to limited options on the DSCR and the drop-down boxes, a carer selected the drop-down box to say Elsie had gotten out of bed. So carers, other carers visiting Elsie understood why this option was chosen, but unfortunately, this caused some panic for the family. Other than that, staff and managers were also worried about information of patients getting out into the wrong hands. So they know in their care workforce, everyone's trained for GDPR, they feel like they know the right people are accessing the right information. But for the family-facing DSCRs, They worried about how controlled and secure the information was on that, and how do we know that it's the family accessing these records rather than someone else? Okay, yeah, next slide, please. And I'm just going to pass over to Nina.
Brilliant, thanks Hayley. So just to close off then, some of the things that came through from this research around what we need to do about enhancing that family and service user access. We know that to encourage some care providers to either unlock or purchase a family feature that gives families those access, we do need to encourage them. And to do that, there's a need to both alleviate the concerns that they have, and secondly, amplify their benefits. And we know that, as Hayley has described, there are a lot of concerns around information being in the wrong hands, around data sharing and security, and about the example that Hayley gave about Elsie getting out of bed, and then somebody seeing that on the care record and going, that's not right, that there is that unintended consequence of then that causing more demand to the care provider. If that family member's ringing up going, this doesn't look right on the record, what's going on here? And does that put increasing pressure on members of the care workforce in terms of how they're recording? So all those concerns and valid concerns that are being had, there is a need to provide that reassurance and guidance around some of those things around data sharing and around levels of access. And again, considering is there opportunities to access shared learning and peer networks and peer spaces to really understand, well, how have others navigated some of these challenges and concerns? And also, what benefits have they realised by doing that? And really learning from other care providers who have done some of this stuff. And I think the other thing there around that encouragement is around amplifying some of the benefits around this. You know, we know that we've heard from this insight that having that access to the care records really gives people that sense of empowerment by being involved, the fact that they can log on at any time and get that peace of mind about the care that's being provided. As Hayley said, if their relatives, particularly if they're living far away, or if they're going through a particularly difficult time with their health, like that reassurance and peace of mind was really coming through loud and clear. And so not only the benefits there to that family member, but also it's actually then supporting efforts as a system. When we think about co-production, we think about people playing that really active role as part of their own care or as part of their loved one's care. So thinking about that. The second point here is two things really. One is that awareness. Fundamentally, families and service users need to know that this is an option available to them, that they can use this. So there's something there around actually, again, communication teams working to raise that general awareness at a general level, but then also for care providers to play that role to make sure that service users and the families are aware that it is something that is available to them if it is. So that's the first thing. So once people are then made aware of it, the second thing is making sure that the support they receive is equitable. There are many people, I'm sure, who can use digital, but as we know, that's not everybody, and we shouldn't tarnish everyone with the same brush. So there's a real need to understand, well, one, do they want to use it? What motivation do they have? Because again, not everyone will. But if they do, what then support would they need to have that capability and confidence to use it? Is there something that they would need around knowledge of how to use it, being supported with the skills to use it, and also reassurance around things like their privacy and so on. And again, we need to be thinking about how that can be provided to the families and service users. And then also the opportunity in terms of access to the tech. Again, let's not make assumptions about who does and doesn't have access to this stuff. But yeah, so that does really pose some questions there around the space of digital inclusion and making sure that digital disadvantage is considered when we think about the use and the benefits it can bring. Some people are going to need additional support to use it. And then finally, as Hayley mentioned earlier, families are going to want access to different types of information. We can't blanket it and say this is exactly the piece of information that all families and all service users want. So actually thinking about how features can be tailored so that it can be tailored to them. They can have a very tailored experience and access the information that is important to them, which goes back really to that need around, in the first instance, there's going to be a need to have those concerns alleviated around opening up every single type of information. So some really important things to consider there. Thank you. Next slide. Brilliant. So that's it as a, again, very rapid introduction to just some of the insights that we found from the wider piece. If anyone does have any questions at the end of this, both alluding to the wider work that we've done, we're happy to share that. But equally, anything specific on the family access, please do let us know your questions.
Great. Thank you, Nina. Thank you, Hayley. That was really, really helpful. I think for me, when I first have heard about the work that you've been doing, I was really interested in this because we talk quite often about how digital care records can really help with access to information for care workers, for nurses, for clinicians, but we don't always talk about what that means for families and for people who use care and support services. And I think there can definitely be a perception that moving to a digital care record might make it harder for particularly people who are in residential care or who are using domiciliary care to access their own records. So it is reassuring to hear that that isn't always the case in all instances. Please do keep questions coming through, but I'm going to take a little bit of a chair's prerogative to ask the first one, if that's okay. Something we hear quite often from care providers who are interested in family access is how they manage the sort of process around consent and who can see information in the family and who doesn't have access and how that's managed. And I was wondering if you had any insights from your research about how any of the care organisations were managing that process and who they gave access to. Oh, you're on mute. Sorry, Nina.
Thank you. So because this was more of a qualitative study, we don't have data on the quantitative side of who was or wasn't using it and the levels of consent. So I do know that part of the process around consent was following some of their traditional processes that they used anyway, but it very much did tailor between some of the care providers that we've spoken to. But yeah, sorry we can't be more helpful than that at this stage.
No, that's absolutely fine. I just thought I'd ask just in case, because it's a question that we get quite often. We've got quite a few people in the chat who are sharing their own experiences as well, who are care providers who have family access portals. So it might be interesting for you to look through that, and also echoing some of the things that you found in your study as well about the expense of it, about sort of managing access. So clearly some universal themes which are coming through. Nina and Hayley are able to stay for the rest of it. So if there are more specific questions that happen, please do continue to put them through to us and we will then ask those at the end. But for now, I think if we pass over to Ryan to do the next presentation on how digital care records can link to a shared care record.
Thank you, Katie. Hello, everyone. Nice to be here. I work in the South West London ICB, the Integrated Care Board, as a Health and Social Care Integration Officer, HASIO. You probably know that the NHS loves their acronyms, as we've already heard with the DSCRs. The London Care Record is part of the Shared Care Record at a London level. Next slide, please. So what we've done as HASIOs, our team of HASIOs, is we've spent 2 years building relationships with all of our care homes, mainly to promote DSCRs and getting funding for digital social care records for care homes to digitize their homes, plus offer some other digital projects. And we've done very well in that time. We're up to 85% of care homes now have a DSCR, which we're very proud of that. And it's all the hard work of the team. It's all about the communication with the homes and establishing rapport. Alongside that, we've worked with the homes on one of the initiatives that South West London has is a red bag scheme, which is a physical red bag. The care we issue them to the care homes. So when a resident is hospitalised, the care home sends the red bag with the London Ambulance Service to the hospital. The red bag remains with the resident or patients once they're on the hospital side through the wards, and then returns with the patients back to the care home as a resident. This doesn't always happen. Sometimes the red bag is lost, but there's also the discharge summary is meant to accompany the red bag back with the resident. This also doesn't always happen. Speaking with care homes and often visiting care homes to discuss their digital requirements, they often refer to the fact there's no discharge summary in the red bag that, when they return from hospital. So this has been a major factor, as well as the other one is our future appointments. I've heard numerous stories of a resident who's due to have a hospital appointment, and then the letter arrives after their appointment has already passed, incidents like that. So discharge summary, these are the issues that were faced prior to the London Care Record coming on board. Care homes said they had no access to repeat medications. There was no previous medical history of a resident coming to their home, no care plans, and no access to urgent care arrangements either once they were admitted to A&E. Next slide, please. So with all this in mind...
Brian, sorry to interrupt. You're just breaking up a little. I wonder if maybe you wanted to turn your camera off and see if it'll be slightly better signal.
Is that... I hope that'll work now.
Yes, that sounds much better. Sorry to interrupt you.
Okay. No, sorry about that. So there was a pilot of the London Care Record, which began in December 22. Across 3 London ICBs, there were 28 care homes who took part to begin the rollout of the London Care Record. This was very exciting because we've been talking about this for a little while in the build-up to this. So we had 49 managers, carers, and admin staff involved, and it was an 8-week pilot. And then we collected the number of hours that were they collected speaking to GP practices and calls, the number of calls, number of hours spent speaking to hospitals, with what I mentioned earlier about the discharge summary. The number of patients not accepted into care homes from brokering team, with missing information, the delay of provision to care residents after a discharge from the hospital, residents admitted to emergency department, and the number of ambulance call-outs. And next slide, please. So we ran that pilot, which was hugely successful. Just some takeaways from that. It was nearly 100% in some cases. They confirmed it was proactive care with the London Care Record. 100% said had a direct impact on their quality of care. And the care homes there was an increase, nearly 100% increase, in the reassurance to family members. That's a big thing. Care homes pick up on that a lot, is that reassurance to the family. It was, well, this figure is slightly skewed. It says 60% of the care homes access the London Care Record daily, but then the next one is 90% used it as part of their daily workflow. They use it regularly. I think we'll put in that data. Obviously, some of them don't have hospitalizations all the time, so they don't always use it if there's no hospitalizations for a little while. And a high number cited a negative impact if this was to be removed from them. So I think there's enough evidence here to suggest that it was well received in this pilot scheme. Next slide, please. Part 2 of this, again, 100% confirmed they made faster decisions, 100% confirmed time saving. And this one I like, and it goes back to what Nina said just now. The care staff felt empowered providing care, having this access. They confirmed there was a reduction in calls made to GPs and hospitals, and a faster discharge process. So huge amount of positives. This was taken on board in early 2023, and then the wheels were set in motion at that point to begin a rollout, which took about a year, where we now reached March, April this year, when we could finally roll it out to the first homes. Next slide, please. And just to give a quick overview, we don't need to zoom in or anything. This is all the a flow chart with showing all the hospitals, trusts, community services, and other healthcare settings who feed into the London Care Record. So bottom left is Southwest London, top left, Northwest London, Northeast London, top right, and Southeast London, bottom right. And so they all feed into the London Care Record. And there was a recent stat in the One London newsletter, which said it's been viewed over 50 million times. That's 50 across, because it's been in hospitals a couple of years. So nurses, ward staff, etc., can view the London Care Record with all these healthcare settings feeding into it. And now the rollout began to care homes as a read only, to view all the information. So if a resident had gone to multiple healthcare settings that feed into this, they would see all those stats feeding into there. And next slide, please. And then this is just the types of information that's available in the London Care Record, the key identifier information, so they can confirm that that's the correct resident, and then the name of the GP. Some homes, not many, have access to GP Connect, which gives them GP records. A number don't. So now with the London Care Record, they'll be able to view the GP records. Hospital and ambulance encounters, the future appointments, that was a key one that the care home cited prior to access. Their past medications, allergies, and as well adverse reactions to medications, that is worth knowing. Vaccinations, the most recent vital signs, care plans, including the Universal Care Plan, which we in South West London are rolling out to care homes. Lab results, radiology, X-ray, procedures, and the all-important discharge summary and London Ambulance Service case summaries. That's been the focal point that we found when we've been promoting this to care homes to adopt, is that discharge summary, because that's been a prominent reason for not getting the information when residents are returned from hospital. And next slide, please. So how it works is the digital supplier PCS, person-centered software. They've been a major player with NHS England in a couple of other digital projects. So NHS England went with them initially to begin the rollout to homes using the PCS system. We're going to reach a point where Nourish, homes using the Nourish system, an equally large digital provider, will come on board to provide that to their homes using Nourish. And then later down the line, the other digital providers will come on board. So it's a phased rollout. PCS, so there will be an in-context link, which you can see on the top right. This is only the residents that are loaded into each home's PCS system will be viewed. There's no search function, so they can't go and look at anyone else that they wish to. It's only the residents that are preloaded into their system, who they may update on a daily basis with their medical records. So the London Care Record is viewable through there, which keeps it secure, so they cannot just go and search for anyone. The next slide, please. There's role-based access, so the care home manager needs to set up the staff. The manager will view all 9 data sets, and a nurse will be loaded on as a manager level as well to view all 9 of these data sets. And then a senior carer would see 6 of these data sets. Enough information still to make decisions about their care, just slightly reduced level of information. And then the third one is for admin, who they will just see the future appointments, so they can book in appointments. And that's been cited as homes who have the access say that even that alone is worth its weight in gold, just to see when the future appointments are coming up, which often is in a short space of time, which they wouldn't have known about otherwise. Next slide, please. This is how it would look. This, just to say, this is also what nurses and ward staff would see in hospitals. All the information feeds into this. This is the dashboard where they can view all this information that I mentioned before, plus a whole lot more, is within these widgets. You can search for particular items such as penicillin. It'll name the health organizations that have data on a service user. You can specify the search to a month, 2 months, 12 months. And there's the description of the data type. So clinical correspondence is one of the main ones which care home managers would access, or care home staff for that matter. They would access that. And next slide, please. That takes us into the clinical correspondence. To break it down is, so discharge summary, that's one of the key ones, and that would open up in there to see, just to see all the information that's been fed into there from the hospitals. All the clinicians would update this, and then it would feed into these records for them to access. There's no print functionality, so this is read only. They're trying to limit information escaping from here, so they access the information, and it's always there. So there shouldn't be any need to to print it off, because they can always come back to this. Next slide, please. Just some of the feedback we've had is, it's been hugely convenient for care homes to use. And like I said earlier, it minimizes paper printing of hard copies. It's, the staff feel educated on the general condition of the resident. It saves time, so they can offer better care to the residents. And like I said earlier, they can check appointments before the letters arrive. Time wasting, that's been the huge factor here. We've spoken with some homes who've gone live recently, and they say that already they're saving time, not chasing hospitals. They've cited incidents where they've spent ages contacting a hospital. Can't get through to the correct department. The hospital phone them back if they're lucky. Can't get through to the person who made the call, and so the telephone tennis begins. So this gives them, they feel empowered to be able to access this information without needing to chase up hospitals and GP surgeries. The discharge summary, as I've said a few times, is invaluable. They say that this is just such a good thing to have. And understanding the resident's medical condition, that as well. Quite often what they mention is when they get a new resident to their home, they might not be the history that they have. In some cases, the resident may not have family to pass on medical information, and they can't access past medical conditions. So they could look into their GP records to understand just what their current medical condition is or was, to make decisions on that. And care can begin straight away with having all this information to hand. And next slide, please. So our experiences with rolling it out, it has been better care for our residents. That's been care homes telling us that they've found, as all the reasons I've already stated, they can offer better care to their residents. The positive feedback from the live homes about the access has been incredibly positive. It builds, from our perspective, it builds relationships and trust between the NHS and our care homes. We've been offering a couple of other digital projects alongside this. And we did struggle in the early days, but we find there's a little, it helps with our rapport, but just offering them this wonderful access to the London Care Record has opened a few more doors that were otherwise shut previously, building that trust. And also from my perspective of leading this out to South West London care homes, One London and NHS England are addressing our concerns with the communications to homes. I'm going to come onto this in a moment with what could have gone better, but one of them was the communications that first came out, because this was new to everyone. One London, NHS England, the ICBs, the care homes, PCS, everyone involved. It was a learning curve for everyone. And the communications that first were sent out, in hindsight, perhaps a bit long-winded. There was a lot of information. One of our issues is we so far we're 50% of our eligible homes who can to take on the London Care Record. We're struggling to get through to a couple of the homes. We're still not sure why. Perhaps it's a lack of education. We've sent these communications out to the homes, but we wonder if there's just too much information going on. Some say they have other projects going on. They're dealing with a lot at the moment. They can't look at this as well, despite the benefits it'll give them. So going forward, the communications from One London will be trimmed down, and then to focus on how to go live, and then with links. This is to look into further information, should you wish. But the key point, let's get them live and obviously inform them and educate them on what they will be receiving. We have had some technical issues on the supplier side, which has delayed some homes going live. There's been a little bit of a blame game with PCS, because it's the first time they're rolling this out to this level. They sometimes experience issues, and then Oracle Cerner, they setting the system up. There's been a few issues that side, so it's establishing who's at fault, if any. There's also been a few issues with some of the homes need to set up, change some settings on their side to enable their sharing agreement with PCS. That's resulted in a slight delay going through the steps. They don't always have time to speak with us to go through that. And so some homes just say there's been an overload of digital projects. we've been forthcoming with our homes, offering quite a few digital projects to which some say, well, there's a lot going on, so we respect that. And when they feel ready, we will reapproach. And so we just don't know if the information was if it was informative enough for them. We're looking at rejigging our own communications to send the One London communications. So it's a learning curve for everyone. It's been an interesting process, and One London, PCS, and NHS England admit as well, we're all in this together. We're learning the rollout. I believe that, if we go to the next slide, I'm not too involved in all these, but so the web portal pilot, this is a slightly contentious issue. This will be for homes that are not digitized. They have no digital system. It's paper-based only homes. They're looking to give them a web access to a web portal. Our Southwest London Information Governance IG has pushed back on that, saying, well, anyone could obtain the credentials and log in and then carte blanche to view almost anyone's medical records. So that's being discussed to try and restrict sort of a wider access. And there's talk of it commencing in Northwest London at the end of 2024. Like I said, our IG didn't get a sign off, but we will await that pilot and then take it from there from a Southwest London perspective. And as I said, only the paper-based care homes will have access to this pilot. The home care and domiciliary services, there's no word yet on when they will have access, but that will be a separate rollout to give dom care, which I think will be a big push forward. I think a few of them don't have a digital system, so this will help them. And then there's the sharing back. This is one thing we've been pushing and trying to promote to enable hospitals and ambulance staff to view the care home resident information. It's not to be confused with the scale up of the in context link. This is a separate where hospitals will view the care home's medical information. The time frame is approximately 1.5 to 2 years. We're not sure if that will actually happen in that time. We hope so, because we feel that will benefit the hospitals hugely. And so watch this space on that. So that's about all. Katie, I don't know if Smithmon is on the call.
Yes, I believe so. Maybe ask to unmute. Are you there, Smithmon?
So it's just one of our care homes, Smithmon, if he can come on, just to give a care home's perspective of how they're finding the London Care Record. Smithmon's home was part of our pilot back in December 22. But I don't know if he's able to come on.
Not sure. I can see somebody with Smithmon's name, and I just asked to unmute. So, are you there, Smithmon? Right. I think possibly, Ryan, we might have to see if we can get Smithmon back in a moment, because I'm not sure if he's managed to join. Yes. But we do have quite a lot of questions which have come through for you in the meantime, if that's all right.
Yes.
Well, okay. So just first of all, to start off, so when you say in context within PCS, so let's say, so if you're a care home who is using person-centered software, you don't have to log into a different system to access the London Care Record, right? It's just within PCS.
And within the resident's profile. So, and then it'll go straight only to that resident's London Care Record. So once they're signed in with their credentials in that resident, then yes.
Brilliant. Okay, thank you. That was just really helpful, because it's a lot of technical terms that get thrown around with this one, obviously. So then we had a question as well from Sue, who says she's interested in the ability for hospitals to see a resident's information. Can this only be used for care homes that use PCS, or will it be for sort of wider technology as well?
Well, that's part of that sharing back that won't happen for another 18 months to 2 years, I think, which is a shame. we really want this to happen sooner. It may do, I don't know. But yes, there will be a huge benefit for hospitals to access the care homes. Another gripe when we speak to care homes is the I say incessant calls, but they get a number of phone calls from the hospital. Once a resident has gone to hospital, we encourage them, and many of them do, is print off all their paperwork, which sounds slightly archaic when they're using these digital systems. However, they still need to print the paperwork off, send it with the resident in the red bag. But they say we send the paperwork and we still get umpteen calls from this hospital department, the pharmacy team, etc., asking which medications they say, but we've sent the paperwork, they haven't reached us yet, which is why we're pushing for this sharing back of information. So hospitals could view all that information already on the digital system in a care home. But I believe there's IG issues around that, and that's their next project.
Yeah, information governance is always a little bit of an issue on this one, but I do think it'll be very helpful. I remember speaking to a geriatrician who works in hospital A&E a couple of years ago now, who said it would be so helpful to have access to the care home information for the people who are sort of presenting at A&E. So it's great to hear that that is something that you are focusing on. So actually on that, so for any care organisation who has access to the London Care Record, do they have specific IG or cybersecurity requirements that they need to meet to be able to have access? Like, do they have to do the data security and protection toolkit or anything before they can join?
Oh, absolutely, yes. One London will only take DSPT compliant and signed our DCC onboarding, our sharing agreement, and we only send those homes through. And then those that are not compliant yet, we work with them to get them compliant, and once they are, then we send them across. Yes, no, it's a stringent process that they must absolutely be, and refresh every year by 30th of June. Yes.
Great, thanks, Ryan. And yes, as you mentioned, there's also a lot of free support around the Data Security and Protection Toolkit. So for anybody, I'm going to take this opportunity to plug the Better Security, Better Care program and the free support that's offered there if you're a care provider needing help on data and cyber. So we have a question as well from Neelam, who wants to know if you have any idea when early adopters with Nourish can go live with London Care Record.
I believe not for, like a month or maybe 2 months. I don't want to say a month, but I think we're getting very close. 2 months, possibly, hopefully not too much longer. Going back to the IG, there's a couple of little, every ICB seems to work differently, and all our IGs are different to each other. So we're all grappling with our own IG to get this across the line. And we're very close. We just had a couple of questions from one of our hospital IG leads asking just to expand and explain a couple of things. So we're working with that to get our Nourish IG through. Other ICBs seem to work differently. But it's, I guess, for that reassurance, the IG is taken very seriously. It's not just whizzed through and said, that's fine for everyone. There is. So the Nourish, the IG hasn't necessarily stalled the Nourish rollout. I think there's been their technical assurance phase has taken a bit longer than they expected to get their systems working to roll this out. But we're hoping things will, once they come on board, it'll be a smoother process because everyone involved will have gone through these motions for the last couple of months, and then we can iron out any difficulties we've experienced already. But hopefully soon. 2-3 months, 2 months. Let's go on that.
Yeah, I think let's be optimistic. That sounds really good. Yeah. And obviously understand there's a lot of hoops to jump through with information governance, but given how sensitive the data is, I think it's probably quite reasonable that people work through that at sort of their own pace. So I think one more specifically for you, Ryan, and then what we might do is sort of take the slides down. I think some of these are sort of more general questions, which Hayley and Nina may also have some input in. So one of the questions was, at the end result to sort of access the London Care Record, who will be the paying customer? Is it sort of the patient's family, the NHS, or care homes? I assume that means sort of paying for the software system.
Yes, I believe it's the ICB. I don't know that side of things.
Okay.
Yes, and I think the digital provider as well, I believe, may have some sort of financial to pay, some financial. But
yeah,
I believe
fair enough.
ICB. Yeah.
Thank you. Great. So Eleanor, if it's all right, if you could maybe just pop the slides down quickly, and I'll invite Hayley and Nina to come back on board as well. Just because I saw there's a question here from SR, which was aimed at Ryan, but I think possibly you may have some thoughts from your research as well, which is from SR, which asked, was there any digital skills audit exercise done for staff members, as some people need help with digital systems? Were there challenges that you faced with staff members adopting and using the software? So maybe Ryan, if you wanted to go first, talking specifically from your digital social care rollout, and then maybe Nina and Hayley, so if anything you saw across sort of Devon care homes.
Yes, so there has been some sort of understanding, I guess, of how to work the digital systems, depending on the care home. The digital providers have offered training and what have you, and then in some of the digital projects, we've gone in and offered our training on the system, how to use it, where to click, etc. And we know not everyone's as digital savvy as others. So and with the London Care Record, that's gone out to homes already who have been using PCS for a little while. So it's just an add-on to that. So in most cases, they're aware of how it works. What One London did was provide dummy resident data to load on as a dummy resident. So to give them carte blanche to just play with the system, it comes up with dummy data to just click, 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 rather than going into a resident's London Care Record in this case. And a couple have asked us, when will the training be? And said, well, there isn't training as such, because we don't want to come and sit next to you and look at a resident's data and so on. Use the dummy resident to just click around, click anywhere. You won't compromise anything. And then and go from there. And that seems to be working. A couple of the homes who needed a bit of assistance with that say, okay, we got it now. Does that answer the question?
Yeah, no, definitely. That's great. Thank you. Nina, Hayley, maybe anything you wanted to add on sort of supporting staff with digital skills?
Yeah, absolutely. I think it's a really useful question. And to echo what Ryan said, really, that we know that there are skill gaps with different parts of the care workforce. We've actually done an additional piece of insight around the use of the Devon and Cornwall care record. So again, a shared care record, and bringing that into a line and sit with the DSCRs. So again, even then, there was real, not only skill gaps, but actually some knowledge gaps about, well, how would that work with this system I'm already using? Will it replace this? So we're seeing not only skills, but knowledge. And I think particularly on the skill element, we did hear some feedback from staff and from managers around the importance of considering the staff members whose English is not their first language, which also adds another layer of complexity when we think about skills to use new systems and making sure there is that simplicity in use. And I think support as well is going to be important. And I'll just hand to Hayley to add probably on that note of support that's needed to help with the upskilling.
Yeah, thank you. Yeah, I mean, there's a huge appetite for that support and training to help people along that journey. And yeah, as Nina said, there was a lot of people that were unsure about and using digital, but also when we specifically spoke about shared care record, there was a lot of, is that the DSCR? Is that the same? What is the difference? How do I do that? There's a lot of want for in-person practical support using templates. Yeah, the templates. Gosh, what am I saying? But yeah, absolutely. There was a huge need for that, huge appetite for it, but not just a one-off training, importantly, but that considered, tailored support depending on people's needs.
Yeah, and I think just on that as well, one of the in terms of the types of support, thinking about that blend of actually, is there somebody within the provider space or within a cluster who is expert and does know how to use it and becomes that ambassador, but also tapping into not necessarily formal support to use, but also things like communities of practice, so people are continually learning from others in this space.
Thank you all. That's really, really helpful. And then we've had a couple of questions about other care settings. So Ryan, is there any sort of thoughts about extending London Care Record into supported living environments or to live-in care in the future, as well as, I know there's domiciliary care is obviously on your roadmap?
Yes, I think it's a slow rollout via domiciliary services, I guess. And then I don't know that far down the track. They haven't said as much. We just seem to be focusing on what we're doing now, and then the web portal, and then going to the dom care and then the sharing back. I don't know about to live-in carers and things and outside of domiciliary, if that'll be a thing, but I'd like to think so. And I think NHS England are talking about trying to get these shared care records, nationally, out this similar one in London Care Records outside of London, to roll it out. And as someone gave the example earlier, if he breaks his leg on surfing in Cornwall and goes home to Newcastle, he wants that hospital to be able to see what happened in Cornwall, sort of thing, for the records to be viewable across the country. So they're working on that, with no time frame yet, I don't believe.
No, and if we do get a solid time frame, we will obviously put out that information and probably be doing another webinar, probably with some kind of celebratory fireworks happening in the background, so we can share that with all of you. Yeah. There's also a good point, I think, here from Abby, which is that they find that most digital social care records are quite focused on multiple visit domiciliary services or care homes rather than live-in care. I think that is feedback that we hear quite a lot, though there are sort of newer digital care records which are coming to market. I don't know, Nina and Hayley, did you do any research in sort of the live-in care space, or is it all sort of care homes, domiciliary care mainly?
Yeah, ours was very much focused on care homes and domiciliary care providers mainly. But I did on a separate note, Katie, see somewhere that if anyone's interested in the wider results that we did find, appreciate it's not in the supported living service sector as such, but we're more than happy. It's not publicly available, but Katie, we can potentially share that wider report with yourselves to then circulate to everyone on this call.
Oh, if you wouldn't mind, that'd be amazing. There has been a request, as you said, which has come through to sort of see your full research. So that's great. I was going to say, please contact you. But if you're happy to share with me, we can make sure that that goes out to people, because obviously you could only focus on a very small section of your research today. But I know there was a lot more in that. So that'd be great.
No problem.
We also will sort of go away and maybe speak to Shared Lives Plus and a couple of the other sort of like trade associations who work more in that space to see if there is something specific we can do, looking at what digital systems can really work in that sector. So thank you for that. That's something we'll take away and come back to you all on. Now, I think possibly Smithmon may have been able to join now. Are you there, Smithmon?
Oh, hi. Yes, I'm here. Thank you.
Hiya. Let me change your name. Sorry about that. So good to see you. Ryan, did you have sort of some specific questions, or I know you talked about what you were going to do?
Yeah. So I'm just gonna share my experience by using the London Share Records and the GP Connect. So we've been using it since the last year, when all this started with. And I would tell from as a care home manager, my perspective is usually, we spend lots of time over the phone when we collecting information from hospitals, GP surgeries, especially getting a test results like after the blood test and everything. Since start we using it, we save so much of time collecting all this data. So once the urine test or if the blood test blood gone for the hospital, so then immediately we will check within about 5 days later, the results will be there. We won't wait for the GP rounds on the following week. We usually let the GP know on Friday, say we have received the results. Is any action need to be taken? So if some people like iron tablets or something like that, GP will issue the prescription immediately without any delay. So which kind of helped in the kind of sense where is especially with like any UTIs and everything. You don't have to wait over the weekend, especially when you come to bank holiday weekends and everything. And there's a 3 or 4 days of gap that won't be there. So there's no delay in care what the residents needed. And the main other thing is about the discharge summary. So some of the care home managers probably have a same frustration. Sometimes we don't get the discharge summary on time, and the hospital sometimes has to send it in a cab. But this way, we'll get the discharge summary immediately, and family will have a more in-depth knowledge about exactly what kind of treatment happened in the hospital and what the changes in the medications and what they're going for the treatment plans, and also any follow-ups or anything like that is everything on the discharge summary. So we can even get the discharge summary before the resident actually discharged from the hospital, which is so handy. And also this is how when a new resident comes to the care home as well, most of the time family doesn't even know what the vaccination they had, what all the entire medical histories, especially somebody has an allergies or anything like that. Not every family member fully aware of it, and half of the family is not even live close to the loved ones anymore. So this way, before the residents comes in, we go through all the medical histories, allergies, and all the vaccinations and everything. And then we have the full care plans kind of ready before even the residents moving in. So we have a good idea about all their medical histories, and then we know some of the things what they do, are like dry skins or kind of simple things. When they do it, we know the reason behind it as well, and this kind of help in terms of putting things in place, especially with speaking to GPs about changing some of the diet plans and getting the supplements and everything in place with immediate efforts. That is kind of saves a lot of times when you come to that, and plus having the GP Connect is really helpful. We have a proxy medication ordering system. Sorry, just my phone ringing. We have a proxy medication ordering system. Sometimes when we do the orderings and we don't know that's been the GP has actually been prescribed it, because most of the time we don't really need all the medication, so we always carry forward. In GP Connect, we can actually see it actually what the amount GP has ordered, so we can actually chase it with the pharmacy and say this date GP have prescribed this, can you have a look for it? So then we have there is a proof that something has been done, and we can send a screenshot to the pharmacies as well. So that way was so helpful, and all the GP notes, the referrals, especially if GP done any referrals to the hospital, even if it's x-rays or scanning or anything, the note is all there, which GP what time has been gone out, and then we can go to the hospital and say, this has been done, can you be chase it up and get this done as well. So in a way, from as a care home perspective, is one of the biggest tool we used it, and is kind of saved a lot of time from the management side and the senior carer side in terms of collecting data, ordering medications, and everything as well. And it's kind of changed the way we work now. Is more proactive in terms of staff on the case. And yes, using that digital tool and getting to know about the residents is kind of more hobby for them as well. So they're getting everything, collecting all that data and coming to me and say, what, we know more about this resident now. He has this done and had several surgeries done. All that kind of information adding into the care plan is will helpful if somebody go to hospital as well. So that's all my overview about the London care records and the GP Connects.
That's amazing. Thank you so much for your thoughts on that. Ryan, I don't know if you wanted to add anything at all.
Yes, thank you, Smithman, for that. Yeah, no, just it's exactly what, when we speak with homes who are using it, say pretty much the exact same thing. They just enthuse about it so much, which is heartening to hear, and encourages us to roll it out to more homes. Just trying to get through to those homes that don't seem to want to connect with us yet, but it's heartening to hear.
I think, Ryan, you've been an amazing, when we started everything, you're the, my go-to person for any problems, and you always been there to help me out and go through that. Initially, something is a new system and you implementing that system into a different culture, changing the different culture where we work. And so it's hard for everyone. I totally understand. I think, and thank you, Ryan, and all your team for helping everything.
Oh, thank you. Yeah, yes, we try and be compassionate to homes. Like we said earlier, some homes, English may not be their first language and don't always understand how to do things, what to do with this and that. So we try and work with the homes and ensure that they understand what they can do. And then once they do, then they're away and they can access all these benefits, whether it's London Care Record or various other digital projects that we're rolling out to them. But no, thank you, Smithman.
Thank you.
Thank you both so much for that. I just one maybe last question for you, Smithman, because we did have a question earlier about digital skills and how staff find using both a digital care record and also the London Care Record. How did you find it? Did your team find it pretty easy to start using this, or was there training that was required and sort of a bit of a learning curve?
So we started, all this digital started from 2021. So just when at the peak of all the COVID and everything started, we decided to go on digital as well. So we submitted DSPD and everything to compliance to collect all the data. That was a huge task. Once that done, we told staff this is what we're planning to do, and there are some staff members they're not fully aware of how to use, smartphones and all that kind of things. We give them a training. The first 3 months, it was full of trial and error. We sit with the staff member. When we even done the rota, we make sure there is a skilled person who know how to use the system with that particular person. And we use the paper form plus the digital form for the first 3 months. And slowly we taken away the paper system. But then after that, when they got, better with it, we appreciate them by giving gift cards and thank them for doing the and also select them as employee of the month. So all little appreciation was being given throughout the time. And now this is part of our onboarding training process to be train them in using all the digital system, because we have other digital platform which we use it as well at the home.
Wow, it sounds like a pretty comprehensive offer. Also lovely that you get gift cards for doing this as well.
Yes.
Right. I'll keep an eye out if there's any other questions which come through in the chat. Just to say that my colleague Eleanor, who's also on the call, I think has worked with you, Smith-Morn, on having a written case study, which should go live in the next couple of weeks. So we will share that as well with all attendees, so you can have a more detailed written account of the experience as well. As there aren't any further questions which have come through just now, Eleanor, if I could ask you to just move on to one more slide, I think. Maybe 2 more slides. And the next one, there we go. Just as a reminder for anybody on the call who has been thinking about digital social care records but hasn't taken the plunge yet, there is still funding available for this year for any care organisation who is currently on paper, who is CQC registered and is currently paper-based for care records, to get funding through your ICBs to access a digital social care record solution. You can pick from a wide variety, not just PCS and Nourish, who obviously we've spoken about a lot today. There's, I think, just under 20 different solutions which are on the assured solutions list for you to select. So if you haven't already, please do visit the digitizingSocialCare.co.uk website, where you can find information about funding. There is also funding available, I should say, from some ICBs to look at a range of other technologies. So even if you already are using a digital care record but are interested in sort of maybe what other tech is available for you, still very, very worthwhile going to their website and having a look at what's happening. Next slide then, please. So all really that's left for me to say then is a huge, huge thank you to Smith-Morn, Ryan, Nina and Hayley for your time today. It's been incredibly helpful. Thank you as well for all of you who've attended today. There's lots of notes I've written down here about things to send you to make sure we're sharing more information. We do have a lot more events coming up on a variety of topics. If there is something particular you're looking for, please do feel free to get in touch with us and we'll see if we can arrange some more information on that. But thank you very much, everybody, and we will get the recording out to you ASAP. Oh, just sorry, a brief one before we finish. Message from Comfort is their financial support for those who are already on the digital social care record. There is funding available for different kinds of technology. If you go to our website, which is just on the slide here, so digitalcarehub.co.uk, we have a section on the homepage which is called Funding Opportunities, where we link to any funding that we see that's available, which you can apply for digital topics. So thank you very much, everybody, and see you all soon. Thank you. Bye-bye.